As the number of confirmed cases of coronavirus continues to rise around the world, we all have to do our part to stop it from getting worse, even if that means drastic changes. Now, among the questions everybody's asking is it safe to go out to eat? Well, here to discuss is Senior VP of Science and Industry at the National Restaurant Association, Larry Lynch.
Good morning. Thanks for inviting me.
Of course. So the CDC, is always revising their guidelines, and in particular, when it comes to being in crowds and going out to eat, they say that can pose a danger in terms of spreading the virus. So what does the CDC say lately about dining out?
So it's really focused on three primary objectives, and one is obviously what we're hearing on personal hygiene, and that's the continuing washing of hands. We've talked about hand sanitizers, and that's certainly an option, but nothing beats that 20-second vigorous washing of your hands, and that's true whether you're a restaurant employee or a consumer. So that's one area that we continue to emphasize in our work. The second, in the restaurants themselves, are enhanced sanitation efforts. When I say enhanced, it's looking at the kinds of sanitizers that are typically used, and we're now getting advice from the CDC on sanitizers that are effective against the virus if it happens to be spread. And then looking at what else has to be cleaned. So oftentimes, now restaurants are looking at cleaning menus, for example, after each use, just to make sure that if someone has to touch a surface, it's been covered. And then the third one, and this is happening now, is that restaurants that remain open are looking at the whole idea of social distancing. And so in many cases, we're hearing that they're reducing their seating capacity just to allow that 5 to 6 foot gap that the CDC is telling us is most at risk if someone's coughing or sneezing, that they might spread the virus. And of course, we'd always encourage consumers who are sick, obviously not to come in. There is an option for delivery. But clearly, making sure that in the dining experience itself, or restaurants that are still open, it's a heavy focus. I mean, we've been teaching it for over 30 years in our Serve Safe program, but clearly the emphasis now even more so on the sanitation components in the front of the house.
Right, and of course, like you say, restaurants are making accommodations, spreading people out, but overall the recommendation, I think for a lot of people would be just maybe stay home unless it's absolutely necessary to go out, but delivery is key, right? Delivery is still going to be open for most restaurants.
Yeah, it is. In fact, we're hearing in cities that are taking the dramatic effort of closing down any public space, including restaurants, and still allowing delivery and in some cases takeout. And again, just recognizing that same focus on safety. Again, the science we're hearing thus far tells us that there's no risk of transmission of the disease via food. And we've been focused for years on the safe preparation of food, so that's nothing new. But then making sure as it leaves the kitchen that it's being packaged securely, and that in essence we create a contactless environment from the point it leaves the restaurant to the point that it gets to the consumer. So, to your point, if people are either having to quarantine or just lock themselves away on their own, or if they're in an area where they're required to, and they're tired of cooking for themselves, they don't want to cook for themselves, that in fact, we still do have a dining option for them.
Right, and what do you say about governments like, for example, in New York City, just I think happening earlier this morning, happening today, they are changing the fact that even bars and other places like that can actually continue to serve even drinks to their homes, or in other spots. So what do you say to governments like that are taking those extra steps?
Well, I think it's an abundance of caution, and I think they've seen the rapid spread of the virus. I think they're recognizing that a total shutdown, it's hard to get Americans the way we are in terms of looking at our freedoms to say I'm going to give everything up. So what can you do to help people who like to dine out, who like some kind of social activity that might have to give up the social side of it because they're not going to be out with friends, but still have some options for dining and socializing they might not be able to do otherwise. So it's a good precaution. And again, as I shared a moment ago, restaurants have had a symbiotic relationship with government for years, where we're a highly regulated industry. We're regularly visited by health inspectors, so it's nothing new for us. And we want to play by the rules. Still have a valid business, a vibrant business, but at the same time recognizing that right now we're living in unusual times. And again, for us, we continue to monitor the CDC and the World Health Organization, our own U.S. Public Health Service, for any advice, and then we're publishing that for our members to make sure they know what they need to do to protect the public and themselves.
Mm-hmm. I think the key here is you can still do things that make you happy. You just have to modify your behavior a little bit, and these establishments and governments are making it easy to do these alternate methods. So Larry Lynch, thanks so much for your time.
My pleasure. Thanks for having me.
Of course. We'll be right back.